Hello guys, hope you are all okay. You are all enjoying your life and welcome back to Dr. Arshad Nadeem Awan ultrasound teaching videos. I'm sure that you're all enjoying all these videos. Today my topic of discussion is spleen and splenic lesions. Ultrasound is a very important tool to find and characterize the splenic lesion. However, ultrasonic findings are overlapping. That's why certain other important features are required, like you should know the previous medical history, you should have to have the clinical presentations with you, you should know about the previous investigations and also ultrasound finding. Basis on all these four factors, you will be able to provide differential diagnosis and will be able to guide for the further management. Splenic lesions can show multiple presentation. It can be solitary or can be multiple. It can be diffuse or it can be infiltrative. Splenic lesion may be cystic, may be complex, or may be solid. Sometimes it is also categorized on the basis of the size. It may be micronodular or it may be macronodular. Ultimately, percutaneous biopsy or splenectomy is required for the further or for the confirmation of the diagnosis. The most common splenic cystic lesions are primary congenital cysts, pseudocysts, and hydatid cysts. These three categories are very common. Beside this, there are certain uncommon cystic lesions as well, called as lymphangioma, hemangioma, hematoma, hemangiosarcoma, and metastasis. These are also the cystic lesions which mimic as a cyst and appear as a cystic lesions on the ultrasonography. There are certain other lesions as well which are not true cyst but mimic as cyst as well, like abscesses, like cystic metastases, like lymphoma. So these are also appear as a cystic lesion on the ultrasonography. Normally it happens to be asymptomatic, but it becomes symptomatic when it gets enlarged or there is certain internal hemorrhage occurs, or sometimes there is superimposed infections occur within all these cystic lesions. This list shows types of splenic cysts which you can easily appreciate on the ultrasonography. We will discuss all these cysts in separate with its particular ultrasonic features later on, but it's just for the starting that you should have the idea that how many cysts you can appreciate on the ultrasonography. So these are congenital cysts, pseudocysts, and hydatid cysts, which are very common. Pancreatic pseudocyst and endothelial lining cysts containing lymphangiomas and cystic hemangioma are though very rare entity. Pileosis and cystic metastases are also rare, but you can still see on the ultrasound imaging. Abscesses and hematoma are the important feature cystic lesion which you can quite commonly see on the splenic region, especially after the trauma. Splenic cyst, as with cyst elsewhere in the body, appears as a well-defined round cystic lesion with equastic enhancement. Usually it appears round in size, maybe small, maybe large, and these are the characteristics of the simple cyst. Sometimes you may come across complex cyst. Complex cyst will be having the criteria of complexity, like there may be thick wall, there may be internal echos, there may be intramural nodules, or sometimes septation will also be there. The small cyst may be within the splenic parenchyma, but sometimes if it gets enlarged, it may become exophatic. How you will be able to appreciate all these cystic lesions on the ultrasonography, how you will be able to differentiate between the primary congenital cystic lesion or pseudocystic lesions or hydatid cysts. So let's start watching these videos. These videos will help you, these images will help you to identify all these three characteristics of the lesions. On this image, this is the coronal image of the ultrasound for the spleen, and it shows a small simple 1.5 centimeter cyst in the upper pole of the spleen. Cyst is well defined. There is no marginal irregularity of the spleen of the cystic margin. No internal debris is visible. No internal soft tissue nodule is visible. So, and also note the parenchyma of the spleen. Spleen parenchyma is absolutely normal, and no marginal irregularity of the splenic margins can be seen. This is a primary congenital simple cyst. Primary congenital cysts. Primary congenital cysts are true cysts. These are also called as epidermoid cysts because it has epithelial lining. Under the microscope, you can appreciate internal lining of the wall. So that's why it is called as epidermoid cysts, and these are true cysts, and these are arise from the mesothelial lining within the spleen. On the ultrasound imaging, it appears as a cystic lesion, well defined, round, anechoic lesion on the ultrasound imaging. The another important feature is when you are doing serial imaging, their size will not be increased. So they do not increase in size as the time passes. So interval imaging shows the size which you have documented in the previous scanning. It would remain the same after 6 months, or even after 1 year, or even after more than that. So these cysts does not change their sizes. So these are true cysts, and these are called as an epidermoid cyst. So let's start watching these images, how it will look and how it will appear on the ultrasound imaging. This is the another slide of ultrasound image showing primary congenital epidermoid cyst. Primary congenital cyst is also called as epidermoid cyst, or you can call it as true cyst as well. Look at this image. This is a large 6 centimeter cyst involving lower and middle pole of the spleen. The upper pole of the spleen is clearly visible. In this image, within the cystic lesion, you can appreciate low level internal echoes. Actually, epidermoid cyst is characterized by the presence of epithelial lining. When you look under the microscope, you will find the epithelial lining, as it is arising from embryonic rest of primitive mesothelial cell within the spleen. So this is actually typical epidermoid cysts, usually present with well-defined wall, thin wall, anechoic lesion, and the main important thing is they do not change over the time. Here on this ultrasound image, you can also appreciate another example of primary congenital epidermoid cyst. Primary congenital epidermoid cyst is, I already mentioned that it has an embryonic origin. So this is a large cyst, 12 centimeter in size. Within the lumen, you can see low level internal echoes. It has almost occupied the entire spleen. The splenic part is no more visible, so that was doubtful. Therefore, further imaging was required, and it was confirmed on the CT images. CT scan done for that patient which you had seen, that was primary congenital epidermoid cyst on the ultrasonography. For the confirmation, CT scan was done, and on the CT images here you can appreciate a well-defined large primary congenital epidermoid cyst in the vicinity of the spleen. Still, splenic parenchyma is not visible because this large cyst is occupying the entire splenic parenchyma. On this image, liver is clearly visible on the splenic side, although spleen is not visible, but you can well appreciate this primary congenital epidermoid cyst with clear wall in the vicinity of the spleen. On this coronal ultrasound image, you can see and you can appreciate two well-defined simple cystic lesions within the upper and middle pole of the spleen. Both cysts are simple cysts, and this was actually incidental finding. No history of trauma or any other relevant symptoms were found. These both are primary congenital simple cyst of the spleen. You can see both having a round regular margins. There is no internal debris or any other contents within the cystic lesion. Pseudocysts, as the name indicates, these are not the true cysts. These are pseudocysts, and these are often complexes. They must be having their complex wall, thick wall, internal echoes, there will be inflammatory debris, or there must be cholesterol crystal within it, there may be wall calcification. So there must be a multiple complex factors within it. It is considered that there must be history of trauma, infection, infarction. So because of these are the secondary cells, these are secondary abscesses, secondary processes. So there must be history of any previous traumatic status or rupture, or sometime there may be any infection. So you have to be very careful while you are scanning these condition, and if you come across with all these complex cystic, so mind you that these are not the true cysts. Sometimes abscesses will also appear as a complex cystic lesion. So these are all pseudocysts. How it will appear on the ultrasound imaging, how we will appreciate that, how we will distinguish it from one another, keeping the history of the patient in view and other investigation of the view. So let's start watching all these images, and hopefully you will be able to differentiate all these pseudo cystic lesions from the primary congenital cystic lesions. This ultrasound image, you can appreciate a well-defined large 8 centimeter cystic lesion with low-level internal echoes. If you concentrate on the side margins of the wall, so you can still find the irregularity and slightly internal mucosal proliferation within it. So this is pseudocyst, and pseudocyst is also called as false cyst because they have no cellular lining. It is considered that these cysts develop secondary to trauma, infarct, or infection, and these cysts are more often complex with well calcifications and internal echoes, as you can see on this image. On this ultrasound image, you can appreciate a well-defined complex cystic lesion in the upper pole of the spleen, and that's measuring 4.5 centimeter. You can appreciate calcified wall. This cyst having a calcified wall. As I mentioned earlier, that it is considered to be secondary to trauma, infarct, or infection, and usually these cysts are complex in nature with wall calcification and internal low level echoes. Here you can see well defined calcified wall cyst in the upper pole of the spleen. So this is a complex calcified cyst. You can label it as a pseudocyst of the spleen. This calcified pseudocyst was further confirmed on the CT images. Here on this CT slice you can see the liver, and you can also appreciate on the left side spleen. Lower pole of the spleen is visible, but a well-defined calcified wall cyst can be seen involving the upper and middle pole of the spleen. So this is calcified cyst. This is pseudocyst. This is not a true cyst, and this is not the congenital cyst. It's likely be because of trauma or because of any other infection, or maybe because of infarct. So therefore you have to take the complete history from the patient before you are diagnosing or labeling the case. Hydatid cyst or echinococcal disease. Hydatid cyst has its own particular appearances on the ultrasound depending upon the stages of the hydatid cyst. There are different stages of the hydatid disease which we can appreciate on the ultrasound and CT images as well. So like it may appear as a simple well-defined simple cyst. So this simple cyst is called as a grade 1 hydatid cyst, while in grade 2 there may be some crumpled membrane within it. There will be low level internal echoes, so this would be considered as a grade 2 hydatid cyst. In grade 3 hydatid cyst there may be multiple daughter cysts. You can see cyst within the cyst, so these are multiple daughter cysts which are considered to be a grade 3 hydatid cyst. For the diagnosis of hydatid cyst, you should have to have a geographic knowledge, like these are usually seen in endemic areas, and there must be involvement of the liver and peritoneal layer as well. You should have to look for the serological investigation, imaging, and other clinical investigations are very important. So let's start watching these images, how this hydatid cyst will appear within the spleen, how we will write the report, and how it will be appreciable on the ultrasound imaging. So let's start watching these images. On this ultrasound image, you can see the cystic lesion within the spleen. This is a complex cystic lesion, and in the cyst there are multiple cysts. So this is called as daughter cyst or multiple cyst within the cyst. This is particular pattern of the hydatid cyst, echinococcal cyst, which is very common, and echinococcal cyst or hydatid cyst can arise anywhere in the body and involve any of the organ of the body. Especially it is commonly seen on the liver, and then after that it is seen in the on the spleen, in the pelvic region. And the another complication of this cyst is it may go to the brain and involve the brain as well. So therefore it is very important to investigate that patient for the further areas as well, whether the liver is involved or spleen or the pelvic region is involved. So therefore you have to do the CT scan to find out that. So this is a particular feature of the hydatid cyst you can appreciate on the spleen. This is the coronal image of ultrasound, and on this ultrasound image you can see multiple dense calcific foci, and these are scattered in the upper pole of the spleen. A lower pole is not clearly visible, middle pole and upper pole can be seen, and dense calcific foci can easily be seen. This image is a bit confusing and it does not clearly show the exact diagnosis. It may make as these are calcific healed granulomas, but in actual condition these are calcific hydatid cysts. So in this case you better advise further radiological imaging, especially CT scan, because CT scan can pick calcification accurately and help us towards the diagnosis. So keeping the previous image in view, this patient was advised CT scan for the confirmation of calcified hydatid cyst, or to differentiate between the calcified healed granuloma. So here the image is in front of you. This is the CT image. You can appreciate liver clearly, spleen is clearly visible, multiple calcified wall hydatid cysts can be seen. So it depends on when you take the CT density, it will helps you to differentiate between the cystic contents and solid contents. So its density confirmed that these were cysts but with the calcified wall. Spleen is within the normal limit. There is no splenomegaly, but you can appreciate multiple calcified hydatid cysts within it. Certain very rare lesion has already been discussed in the introduction section, like there may be lymphangioma, hemangioma, hematoma, cystic metastasis. These are very rare. On the basis of ultrasound imaging, it is not possible to differentiate all these from one another, but careful history or certain other investigation might help towards the diagnosis. So these are all the rare conditions which you may come across, but so far their particular diagnosis is concerned on the grounds of the ultrasound. You cannot confidently diagnose whether this is hematoma or hemangioma or lymphangioma or hemangiosarcoma. So therefore advise, if you come across all these lesion, or if you come across any suspicious lesion or atypical lesion, always advise MRI. So MRI is the best next modality to diagnose all these lesions of the spleen. Splenic abscesses are very common, and you can appreciate on the ultrasound imaging as a complex cystic lesion, as these are not true cysts, so that's why it appears as complex. There may be thick wall, there may be low level internal echoes, there may be possibility of gas producing organism which will appear as a dense calcific foci with reverberation artifact. It means like you will see dirty shadowing. So it will cause dirty shadowing, it will indicate that there is some gas producing organism. So far the ultrasound images are concerned, these are very specific particular images, and you can easily appreciate the splenic abscess on the ultrasound imaging. There must be history available, there must be some other investigation available to you, through. So far the treatments are concerned, so percutaneous catheter drainage is one of the best solution and best treatment option which can be offered in radiology department. So let's start watching how it will appear on the ultrasound imaging and how we will appreciate splenic abscess on the ultrasound imaging. This slide shows splenic abscess. Its magnified view to clarify the presence of gas which producing dirty shadowing. In this case, spleen was enlarged and upper pole showed complex cystic lesion with irregular wall, internal debris and dense calcification with dirty shadowing was visible. Later on microbiological examination, it was confirmed as gas producing organism. For further examination, CT was advised to confirm the case of abscesses because CT is the reliable method to confirm the abscess. For the previous patient, a CT scan was performed to confirm whether this was truly abscess or not, and second to confirm the gas producing organisms as well. Here on this CT image, you can appreciate that the size of the spleen is enlarged. In the mid pole, you can appreciate hypodense area with irregular outline. Beside this, gases shadowing is also visible, so it is confirming here that this is abscess with gas producing organism, and splenomegaly is visible. On the right side, you can appreciate the liver, gallbladder is clearly visible, both kidneys are clearly visible. So this CT confirm splenic abscess with gas producing organisms. This image also shows splenic abscess. A well-defined complex cystic lesion is visible in this image. You can appreciate its thick wall with low-level internal echoes and debris. You can easily appreciate all these three components within the cyst. Cystic lesion is protruding outward from the splenic capsule, which is clearly visible on this image. This is splenic abscess with subcapsular and pericapsular extension. So this extension can be easily seen, and later on, if not treated, this may spread and involve the other areas of the body as well. So this is an example of splenic abscess. Yes guys, this was all about the splenic lesions, especially cystic lesions. I have discussed about the primary congenital cystic lesions. I have discussed about the pseudocysts. I have also discussed about the hydatid cysts. Abscesses are very common. I have also included abscesses beside this certain rare lesions you can also come across while you are scanning the spleen region. But keep in mind that all these rare lesions cannot be classified, cannot be diagnosed confidently on the ultrasound. You need to have further radiological imaging. As I mentioned in my previous videos, that please concentrate on the report. Report writing is one of the skill which will help your colleagues to identify the lesion, which will help your patient towards the proper management. So whenever you come across the lesion, always focus on its characteristic, give it size, give its location, and ultrasound characteristic, characterize that whether this is complex, this is simple, and at the end you should have to give your diagnostic list. You should have to give not the long list, but you have to give your narrow differential diagnosis, which would be always helpful. When you come across with any of the cystic lesion, it is wise to mention the volume. Give the volume, that much volume this cyst contain. So this was all about the splenic lesion, and I'm sure this would be pretty much helpful for you. Do not forget giving me your feedback. Keep watching my video. In the next video, I will discuss about some other lesions, some solid lesion, some cancers as well. Give me your feedback, drop me a line, and I will get back to you. Till that, take great care of yourself. Enjoy your life. Keep watching my video. We'll see you in the next video. Till then, bye bye.